now's an opportunity to answer any questions from the public. And a number of those are coming in, and I'm just going to see if I can pick a few out and then try and redirect them to the appropriate chief to answer, and then give a few seconds for that person to come off mute and to pick that question up. All right. So the first question, I think, just reading it quickly, I can see it's a Paul Bannister question, and that's, what's the difference with the shared care record mean to patient experience and access to the hospital? So that's just picking up on one of the themes that Paul talked about the work that's already progressed on shared care record and our ambition to do more in that space. So Paul, if I could ask you just to elaborate and answer that question.
Yeah, thank you, Chair. So two things go together here, the shared care record and then the portal, but just around the shared care record. So essentially this enables clinicians from across a range of different settings, so whether it's your GP practice, your community provider, your mental health or your acute trust, and eventually your local authority, to see all of the records that are held in relation to your care from whichever setting they've got. So hopefully they can provide the most joined up care, the most intelligent and timely, effective decision making and communication for you at the point of care. So that's stage one. When we launch the patient portal, that's hopefully when the patient experience, as opposed to just the patient care, will really then kick in, because that will mean the patient will be able to see their own record of their own care and their administration, their letters, their bookings, and reschedule lots of those if they need to, wish to, in the same way that the clinicians do within the trust. So at the moment, it's about giving really good access to clinical data for the doctors and the nurses and the physios, etc. And then later this year, it will be about joining that up for the patient via the portal.
Thank you, Paul. That's a very, very good answer. Let me move straight on to the next question, which gives me a clue I need to send it to, because it starts with, could you ask the CEO? That's a very easy thing for me to do. So could you ask the CEO to give a high-level overview of what he sees as the future ambitions for the trust? The sort of where are we headed type of question.
Thanks, Phil. And it's early days for me, so I'm not sure I can give a complete or a final answer. But the trust already expresses what I'm interested in doing, which is the best care for every patient every day. We exist to provide safe and high quality patient care and to be an excellent employer of the staff who do that. And I don't think that being a new chief executive changes any of that. I set out some of my priorities to work on the support the patients in the flow, support the staff in the flow of patients, emergency and elective, to make sure we maintain financial security, stability, to take forward the redevelopment, and crucially, I think, to continue what Mike talked about, to be innovative in healthcare. It's not the only thing we've done, but the virtual hospital really does change the nature of healthcare, and we're at the start of that journey. And I think that we should invest, we should work hard on that, and we should work with patients and staff to take that forward so that we really can give them the very best. So that's my sort of starter. I think in a way I'd pose the question back. I've been very fortunate to come into a well-established, successful, extremely well-led board, and I'm looking to make my contribution. I do want to refresh the strategic direction, and I'm open to feedback from inside and outside of the trust. We want to work very closely with our partners to take us into and through the next chapter.
Thank you, Matthew. And I'm just reading the next question as Matthew was finishing there, and I can see, but being asked about, we've described a number of achievements in the 2021 period, all of which we are proud of and a very commendable achievement. But the question is being asked, what do we think will make the most difference to both patient and staff experience? Now, I think that could go to any one of the executive team, But I'm going to start with Tracey, if I could, and just ask Tracey, with all the things that are going on and things that we described, what do you think from a safety and patient perspective you want to see succeed in the year ahead that we might even be talking about at the next AGM?
So I think in terms of patient safety, we continue with our innovation and the work that we're doing to continue to maintain safety. But I think that links with the work around health and wellbeing and that recognition for our staff. And that's fundamentally, I think, what's really important for the staff, and to have the best environment that they can to work in to deliver that care and treatment for patients. So continuing to build on innovation and supporting safe care.
Thank you, Tracey. And I'm going to ask the question of Sally, if I could. Let me position it slightly differently. Sally, I know the work you do, you work with the Ambulance Trust, you work with other organisations trying to make sure we do all we can for patients. What do you see as the thing that coming up, or the thing that we might be working on already, will make the most difference to our patient experience going forward?
Thank you, Chair. System partnership working is really critical, as I indicated through my slides, with the levels of demand for care and the way in which we need to respond to the needs of our patients. System partnership working is critical, looking at new ways of meeting the needs of our patients. And as Tracey said, innovation plays into everything that we do as a system overall. So the technology that we've been able to utilise during COVID, we know that many patients have liked that way of service delivery, trying to minimise the need for journeys to hospital where it's possible. And similarly working with partners around different ways of delivering care, and most importantly responding to our patients' desire to obviously stay in their own homes. So lots of work to be done around maintaining our patients in the community, but making sure that they get good wraparound care from us as a system.
Thank you, Sally. And finally, I'm going to sort of extend the question slightly, Claire, and I'm going to ask you today. There are announcements on investments all the time in the NHS. Today there was an announcement which we were party to. Could you just give the audience a little flavour for what was that announcement and why might it be important for both patient and staff experience?
Thanks, Phil. So yes, today we're really pleased that there was an announcement made that we will be receiving funding for a community diagnostic centre at St Albans Hospital. So what that is creating more diagnostic capacity in the community close to people's home that will allow us to diagnose and treat more people. We know that we're seeing significant growth in diagnostic requirements as medicine changes. It allows us to bring lots of capacity together in a single place, which is much better from a workforce perspective because you get that sort of economies of scale and ability to cross cover, which works much more effectively. And from a patient perspective, the reason we wanted to do that at St Albans was to ensure that we can develop one-stop care. So as we develop our cancer services in St Albans and strengthen surgery, we want people to be able to come and have their diagnostic and receive their get all their, sorry, is my language. They'll be able to come see a consultant, get their diagnosis, and then be able to make their plan for any future treatment that they might need all at one time, rather than having to come back multiple times. I should also add that while it wasn't explicit in the announcement, the capital we asked for also included the replacement of some important gamma cameras at Hemel Hempstead. So that will also allow us to have better equipment there that will be more reliable and therefore better for patients there too.
Thank you, Claire. Now, we did have a question earlier on email, not on the chat, but on email. And the theme of that question was really, if you look at the performance of our organisation relative to others in the UK, we are in the middle of the pack. And it sort of challenged us on why is that and what are we doing to address it? Some of which I think has been answered, particularly by what Sally's explained. But I think it'd be an opportunity perhaps for Matthew just to start a bit of dialogue on what are we doing to improve particularly our elective and A&E performance.
Thanks, Phil. And Sally might want to pick up after me on any of the detail that I've missed. As people have talked about throughout this meeting, there's been great progress at this trust, and I do pay tribute to the people that have been here a while and all of the hard work they've done at all levels within the organisation. I think that many of the fundamentals of patient safety, financial stability and high quality services have been tackled and secured. And the next part of our work is to improve flow and productivity with the resources that we've got. Those are not challenges unique to us. They're across the whole NHS, as everyone's aware. We're not alone in working with our partners to find those solutions, whether it be cross-system working, as Sally talked about, on the emergency and urgent care pathway to make sure that patients throughout that journey receive the care they need where and when they need it, whether it's on the elective and cancer pathways post-COVID to tackle those cases and to ensure that patients receive timely treatment. And we're bearing down on the long waiters, very good performance, as Sally said, on the 104-week waiters. And the next step for us is the 78-week waiters, and we're doing well with that, thanks to our colleagues in the surgical division and other parts of the trust. So I think people should be reassured that we're aware of the challenges, we're facing up to them, we're working with our partners to tackle them. Sally, did you want to add anything to that?
I think you've covered it perfectly, Matthew. Thank you.
Thank you both. I have one final question. I just want to point towards Andrew, if I could. Andrew, we talk about the challenges within the organisation, and those challenges, particularly on the elective and the throughput that we've just been describing, require our staff to continually go above and beyond. And I know you're very keen on rewards, you're very keen on recognition, you're very keen on saying thank you. Do you just want to give us some idea, excuse me, of the things we got coming up to say thank you and recognise our staff?
Yes, thank you, Phil. You're right. One of our priorities, I think Tracey's mentioned, a number of others have mentioned, the well-being of our staff, but also recognising the great work of our staff. We've got our Star of Hearts recognition award ceremony coming up at the end of this month, and we very regularly go out and say thank you to our staff, and we've got a very visible executive team who make time for our staff, listening to them and making sure we recognise them, recognise our staff. We've got an awful lot of talent within our staff, with a lot of innovation, as some have said, a very talented group of staff that are highly skilled, and our support for wellbeing and recognition is really important to take us forward in terms of how we deliver our services.
Thank you very much, Andrew. Now, I can't see any other questions unless I'm reading the wrong part of the screen. So I think what we do is, if I could just go into a quick wrap up of the AGM. I want to thank all those who have been online, particularly the team that made the time to join us. A very special thank you to all those who prepared the presentations, both those who presented them and some of the hard work that's gone on in the background to make the presentation pack as meaningful and precise as possible. Obviously, I want to thank the comms team and Barbara and everybody for making everything come together. Any questions that do come in after the event, we will answer and we will put up on the website. As you saw from the presentations and from some of the Q&A, it was quite a year, the year we've been talking about. But with winter ahead of us, and we've just crept into the autumn, so winter's not that far away. It will be another tough year. And with the cost of living challenges that are going on, it will be a very tough year. But I remain confident that the team is extremely well prepared, and we have well prepared plans to survive it all and to face anything that lies ahead. And I'm really confident that our next AGM, we will be reporting new innovation, new achievements, new changes, and many things will improve both staff experience and our patient experience. I want to thank Matthew for co-hosting with me, and a special thank you to all of our staff who have had a very difficult summer with some of the hottest conditions we've ever had to operate wards in. So at that point, I just want to say thank you to everybody who's been involved. Thank you those who made time tonight, and I'll close the AGM and wish you all well. Thank you and good night.